Globally, up to 1 billion children have experienced physical, sexual, or psychological violence in the past year. And most of these are hidden, unseen, or not reported. In the Philippines, 80% of our children have experienced one form of violence. The National Baseline Study on Violence Against Children showed that 3 out of 5 Filipino children have experienced physical abuse, psychological abuse, or have been bullied. And 1 out of 5 have experienced sexual violence. There are many acute and long-term consequences of child abuse because, as in the book of Van der Kolk has beautifully narrated, the body keeps the score, such that years later, decades later, that experience of abuse is transformed into chronic disease like heart disease, diabetes, certain cancers. In the beginning, we were just thinking about a child abuse clinic at PGH that will treat the acute injuries, physical injuries, the mental health problems, keep the child in school, hook up the family with resources in the community, and try to make the system friendly and not re-traumatize the child as she goes through the system. But we found out that what we were doing was just not enough. We had to work with the police, the justice system, the courts, the Department of Social Welfare and Development, the local governments, the barangays, the Department of Education. We needed a memorandum of agreement with all of these government agencies because everyone needed training. We found out that any failure in one part of the system can result to failure by everybody. So we had to work together, competently and compassionately. We realized that child protection is really nation building because the state of our children is the barometer of how well our country is doing. Now, the good news is that we know now that child abuse can be prevented. There are scientifically proven programs that have been shown to work. The Philippines has a Philippine Plan of Action to End Violence Against Children, and this is based on Inspire, which is a package of services that has been shown to work both in prevention and intervention. One example of that is the Parenting for Lifelong Health, which has been adopted in the Philippines to be the MAPA, Masayang Pamilya Parenting Program. And research done in the Philippines has shown that MAPA can reduce child maltreatment by half among 4-piece families. We have the programs. What we need is to scale up these programs